Minister, parents are very worried tonight. They're worried that their child might have had an unnecessary operation. They look to the government for answers, but all they seem to get is an endless commentary. Now, I heard your commentator-in-chief on the news earlier, your boss, the Taoiseach. Jesus, he was outraged. He described in detail long lists of all of the people who he thinks should have been paying attention, conveniently forgetting his own role, a former Minister for Health, and the role of his own government in yet another scandal. Scoliosis scandal, cervical check scandal, Children's Hospital overrun scandal. The list goes on and on and on. And the questions that parents are asking, it's a fairly simple one, I suppose, could this have been avoided? The consultant identified by the 2021 internal investigation into CHI, who it is alleged was enriching him or herself at the expense of sick children, may be a pretty poor example of this behaviour, but the current system subsidises the failing of the public sector by funding the private sector. And your colleague, Deputy McGreenan, said it. She said the parents, these are her words now, they wanted to do their best for children and get the best care, and that's why they had private health insurance. Imagine that, from one of your own colleagues. Private health insurance. Get yourself as far away from the public system as controlled by your government as you possibly can. Do right by your kids. Get private health insurance. Jeez, that's some message. That is some message for parents, because I don't know what you're saying to the parents who can't afford private health insurance. I don't know what the message to them is this evening. But you have created a system whereby there are two tiers. Mechanisms like the National Treatment Purchase Fund create perverse incentives. Now, it's 7 years since I met with the now Taoiseach, then Minister for Health. And I outlined to him a proposal that was a Sinn Féin proposal, but it works in other jurisdictions, and we had modified it for this particular jurisdiction, and we called it COLISTA, a single integrated waiting list management system, which would remove those perverse incentives and ensure that the health service was working at maximum capacity, so that a person who was waiting could get the next best place for them. It would eliminate, to a huge extent, the perverse incentives that apparently have been highlighted now. Those perverse incentives have served to let children down. And in my final few seconds, Minister, I will say this. Parents will have a voice in this chamber, because we will ensure that they have a voice in this chamber. Thank you for heckling me, Minister. Thank you. This is my time. This is my time.
Deputy, your time is up.
Good morning, Ceann Comhairle.